Fetal circulation. Simple notes for BSc nursing students. Introduction. Fetal circulation is different from adult circulation because the fetus gets oxygen and nutrients from the placenta, not the lungs. The fetal circulation has special structures to bypass the liver and lungs, which are not fully functional before birth. Main components of fetal circulation. 1. Umbilical vein, oxygenated blood transport. The umbilical vein carries oxygenated blood, 80% saturated, from the placenta to the fetus. It enters the fetus through the umbilicus and runs along the falciform ligament of the liver. In the liver, it gives some blood to the left lobe and mixes with deoxygenated blood from the portal vein. Most of the oxygenated blood bypasses the liver through the ductus venosus and enters the inferior vena cava (IVC). This mixed blood has slightly reduced oxygen content. 2. Blood flow in the heart. Right atrium. Blood from the IVC enters the right atrium, where it is directed toward the foramen ovale by the valve of the IVC and crista dividends. This well-oxygenated blood, 75%, moves into the left atrium through the foramen ovale. The remaining low-oxygen blood, 25%, from the IVC and superior vena cava (SVC) enters the right ventricle. Left atrium. The oxygenated blood that passed through the foramen ovale enters the left atrium. It mixes with a small amount of venous blood from the lungs. This blood is then pumped into the left ventricle. Left ventricle. The left ventricle pumps oxygen-rich blood into the ascending aorta and aortic arch. This supplies oxygen to the heart, head, neck, brain, and arms. Right ventricle. The right ventricle receives deoxygenated blood from the right atrium and pumps it into the pulmonary trunk. Since the fetal pulmonary arteries have high resistance, only a small amount of blood goes to the lungs. Most of the blood bypasses the lungs through the ductus arteriosus and enters the descending aorta. 3. Ductus arteriosus and descending aorta. The ductus arteriosus connects the pulmonary trunk to the descending aorta, allowing blood to bypass the lungs. The blood from the proximal aorta mixes with this blood and supplies the lower body. 70% of the cardiac output is carried by the ductus arteriosus to the descending aorta. 4. Return of deoxygenated blood to placenta. 40% of the combined cardiac output is sent to the placenta through the umbilical arteries. The two umbilical arteries carry deoxygenated blood to the placenta for oxygenation. Key points to remember. Fetal circulation is designed to bypass the liver and lungs. Foramen ovale allows oxygen-rich blood to go from right atrium to left atrium. Ductus arteriosus allows blood to bypass the lungs and go directly into the descending aorta. Umbilical vein carries oxygenated blood from placenta right pointing arrow fetus. Umbilical arteries carry deoxygenated blood from fetus right pointing arrow placenta. Mean fetal cardiac output equals 350 milliliters per kilogram per minute. Changes in fetal circulation at birth. At birth, the fetal circulation undergoes major changes to adapt to life outside the womb. These changes happen due to 1. Cessation of placental blood flow as the baby is no longer connected to the placenta. 2. Initiation of breathing, lungs take over oxygen exchange. Major changes in the circulatory system. 1. Closure of the umbilical arteries. Functionally closes immediately after birth to prevent blood loss. Anatomical closure takes 2 to 3 months. Distal part becomes lateral umbilical ligaments. Proximal part remains open as superior vesical arteries supply blood to the bladder. 2. Closure of the umbilical vein and ductus venosus. Umbilical vein closes later than umbilical arteries, allowing the baby to receive extra 80 to 100 ml of blood from the placenta. The ductus venosus collapses, causing a drop in venous pressure in the inferior vena cava (IVC) and right atrium. Final changes. Umbilical vein right pointing arrow ligamentum teres, round ligament of the liver. Ductus venosus right pointing arrow ligamentum venosum. 3. Closure of the ductus arteriosus. Starts closing within a few hours after birth. Closes in response to increased oxygen levels in the blood. Prostaglandins keep the ductus arteriosus open during fetal life. After birth, prostaglandin levels drop, leading to closure. Functional closure happens quickly, but anatomical closure takes 1 to 3 months. Final change. Ductus arteriosus right pointing arrow ligamentum arteriosum. Clinical note. If the ductus remains open, patent ductus arteriosus, PDA, it may cause heart problems. 4. Closure of the foramen ovale. Caused by pressure changes. Left atrial pressure increases due to lung circulation. Right atrial pressure decreases as placental blood flow stops. Functional closure happens soon after birth, but anatomical closure takes about 1 year. Temporary reopening, cyanosis. In some newborns, the foramen oval may reopen during crying, causing a bluish skin color due to right to left blood shunting. Post-birth circulatory adjustments. Cardiac output increases to approximately 500 milliliters per minute within 1 to 2 hours. Heart rate stabilizes at 120 to 140 bpm. Key points to remember. Placental circulation stops, and the baby's lungs start functioning. 4 major fetal structures close. Umbilical arteries to lateral umbilical ligaments. Umbilical vein to ligamentum teres. Ductus venosus to ligamentum venosum. Ductus arteriosus to ligamentum arteriosum. Foramen oval to fossa ovalis closes within a year. These changes ensure proper postnatal circulation. This transformation is crucial for survival outside the womb. Thank you. Please like, share, comment, and subscribe.